Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Saya harap awak semua sihat, dan dalam keadaan yang baik lah. Alright. So minggu lepas kita dah belajar berkenaan dengan physical, physical injury and control. Di mana konten dia ada kita apa cerita berkenaan dengan introduction untuk physical injury dan control. Kemudian kita ada untuk construction work, mechanical work and electrical work punya physical injury and control. So untuk minggu ni, minggu ni nanti 20 hari bulan, 20 hari bulan April 2022, bersamaan dengan hari Rabu. So kelas kita pukul 2. Alright. Jadi kita akan sambung dengan chapter 4, berkenaan dengan health hazards, bahaya kesihatan. Alright. So subtopik dalam chapter ni adalah berkenaan dengan introduction, health hazard and hygiene. Kita ada chemical hazard, physical hazard and also biological hazard. So 4.1 Introduction to Health Hazard and Hygiene. So ini a little bit of history. So in 5th century BC, Hippocrates, a Greek doctor, initiated scientific foundation to make a link between the adverse effects suffered by lead workers and their exposure metal. In the 1st century after DC, Pliny, the Roman elder, recorded how workers refining red mercuric sulfide wore blades over their faces to avoid inhaling dust. Only in 15th century that the dangers in substances such as lead, mercury and dust from mining became widely recognized and efforts were made to reduce exposures. In 18th centuries, Ramazzini, an Italian doctor also known as father of occupational medicine, published books on diseases related to exposures of metals, dust and some chemical, and also the importance of physician to inquire patient's occupation. So, definition of occupational and health. So, yang lepas pun kita dah pernah tengok, apa maksud occupational and health. So, ini kita tengok dari segi ILO ataupun WHO tahun 1995. So, occupational health is the promotion and maintenance of the highest degree of physical, mental and social well-being of workers in all occupations by preventing departures from health, controlling risk and the adaptation of work to people and people to their jobs. Hazard types: acute and chronic. So what is acute? Acute is immediate in their effects and relatively simple control. Chronic, difficult to access or identify as they may take a long time to have any effect. So ada dua tadi untuk bahaya tu tadi, jenis bahaya ada acute dengan chronic. Di mana acute tu pertengahan lah maknanya in their effects pertengahan and then relatively simple control. Contoh macam demam lah. Demam biasa. So chronic ni yang macam mana? Contoh macam sakit jantung. Macam tu lah. Right? So principle of prevention and control: anticipate, identify or recognize, assess or evaluate, control and review. Hierarchy of control: eliminate, substitute, isolate, engineering control, administrative control and also using PPE. So health surveillance and biological monitoring. Health surveillance is the monitoring of individuals in order to identify changes in health due to exposure to hazardous substances. Biological monitoring is the measurement of a hazardous substance, its metabolite or other substance like enzymes in body tissues, fluids or exhale air. So occupational rehabilitation. Rehabilitation includes the medical treatment which assists recovery as well as management of the process which help people stay at or return to work. So 4.2. Okay, we go to chemical hazards. Okay, bahaya kimia. Alright, so ada beberapa subtopik, ada 4 subtopik dalam ni. Jadi kita tengok satu persatu. So legal provision. Okay, legal provision in chemical hazards. So legal provision, factories and machinery. Okay, ini dia punya akta lah. So akta untuk lead, asbestos process, and then ada mineral dust. Okay, mineral dust. Okay, kemudian 5 main aspect related to this statutory. Okay, permissible exposure limit, exposure monitoring, medical inspection, control methods, other matters such as records, penalty, and etc. So, ni legal provision. Okay. So, untuk Occupational Safety and Health Act, okay, OSH kenaan dengan Control of Industrial Major Accident Hazards, okay, Regulation Peraturan 1996, okay, Control of Major Disaster Caused by Chemical. Ada satu lagi untuk chemical classification, packaging and labeling of hazardous chemicals. Ni kena ada label. Okay, kemudian ada prohibition of use of substance. Okay, kena ada kebenaran untuk menggunakan substance tu. Prohibition of dangerous chemical. Okay, management of chemicals, PEL, evaluating risk, medical monitoring. Okay, so how chemical affect health? So direct contact. Okay, dari segi direct contact with corrosive chemicals such as alkali or acid. Okay, irritant chemicals cause skin to flare up, cause skin allergy, example nickel. Okay, so kadang ada jenis bahan kimia ataupun besi sekalipun kan, alright. So membuatkan kulit kita bereaksi lah terhadap perkara-perkara chemical ni. So chemical routes of entry into human body. Okay, ada 4. Okay, exhalation, inhalation. Okay, daripada awak bernafas. Ingestion. Okay, awak mengunyah. Absorption. Okay, diabsorb. Kemudian injection. Okay, chemical routes of entry into human body. Okay, ini adalah tempat-tempat dia masuk lah. Cara dia masuk, inhalation, ingestion, absorption, and injection. Okay. So inhalation, breathing and smoking causes us to inhale substances which enter the lung. Substance inhaled into the lungs are readily absorbed into the bloodstream. So kat sini, siapa yang smoke, so kena fikirlah orang lain juga. Kena fikir orang lain. Kalau nak smoke kat tempat lain lah. Yang tak ada orang. Okay. Bahkan kalau smoke dalam tandas pun kan. Orang, contoh awak tanda hawam. Jadi orang akan masuk tanda hawam tu dan orang akan bau. Jadi tak elok lah. Biar tempat yang mana memang orang tak datang pun tempat tu. So carilah. Try cari. Kalau jumpa ya. Alright. Okay, ingestion. Swallowing a substance causes penetration into the bloodstream via the stomach and small intestine. Okay. Kemudian absorption, entering the body through the skin causes substances to enter the bloodstream at a slower rate than by inhalation or absorption. However, the resulting entry and distribution within the body is the same. Okay. So injection occurs when substances are forced through this skin. Okay, this can occur as a result of such means as compressed air or by having the skin abraded by a penetrating object. Okay, disuntikkan sesuatu dalam tubuh badan. Okay. So dangerous situation, increased risk exposure. Okay, which is lack of awareness on hazardous chemicals, leakage or accidentally spillage of chemical, working in a enclosed area or room with poor ventilation, doing routine that involve chemicals, machine breakdown, lack of safety management. Okay, this is dangerous situation that can increase risk exposure. So, chemical safety data sheet. Okay, CSDS. Okay, chemical safety data sheet. So, introduction. Chemical safety data sheet is a brochure or informational paper containing information related to hazardous chemical which are important in the safe use and handling of chemicals at workplace. So objective of the chemical safety data sheet is to understand the safety recommendation and their rationales. Okay, rationales. Okay, realize the result of failure to comply to safety requirements. And then OSH prohibition of use of substance order 1999. So identify symptoms or overexposure. Obtain input for the formulation of strategies and recommendation in the safe use of hazardous chemicals. Okay, ini antara kepentingan ataupun objektif kenapa perlu ada chemical safety data sheet. Okay, so legal provision. Okay, ini termasuk dalam regulation 9 dalam kurungan 1 of the OSH classification, packaging and labeling regulation 1997. Right, 1997. Okay, di mana it requires supplier to prepare and provide chemical safety data sheet for every hazardous chemical supply. Supplier is defined as the party supplying the chemical to the user, which includes formulators, manufacturers, importers or distributors. So supplier also required to review the data sheet, okay, regularly. Okay, so the information required must be with the objective to protect the safety and health of the worker and not for use for any reason. So mandatory information. There are 15 types of information required. Okay, chemical product itself. Ini untuk yang ni tadi lah. Okay, untuk perlu ada mana information. Okay, antara information yang diperlukan. Okay, ada 15 ni. Chemical product itself, lepas tu apa nama chemical tu lah, maksudnya company identification dia, composition dia, apa bahan dalam tu kan, ke hazard identification, apa kemungkinan yang akan berlaku, okay, first aid measures, contoh kena buat apa, contoh kalau kena acid, biasa dekat makmal kalau kena acid kita kena akan buat apa, so kita kena terus cuci, okay, cuci dia ada air di dalam tu kan, ada tempat untuk misalnya kata kalau terkena acid atau apa. Kalau biasa dekat fume chamber, dia berdekatan dengan fume chamber. Kalau awak tahu fume chamber, okay, fume chamber tempat di mana segala chemical, okay, segala chemical yang contoh di dalam makmal yang nak dia buat, okay, semua dia buat dekat fume chamber. So dia punya apa bau ataupun reaction tu dapat tak orang kata tak menyebar, sebab dia ada fume chamber. Okay, kemudian kita ada accidental release measures, lepas tu handling and storage macam mana, kena ada exposure control and PPE, physical and chemical properties, stability and reactivity, toxicology information and ecological information. Okay, ada lagi disposal information, transportation information, date of preparation. Ni kena ada lah. Okay, so kita pergi pada physical hazard. So tadi chemical hazard. Okay, chemical hazard mostly berlaku apa boleh masuk dalam tubuh badan kita melalui 4 perkara lah. Okay, so 4 perkara tu adalah inhalation, injection, absorption dengan injection. So dari segi physical hazard, untuk bahaya pada physical, apa, noise, vibration and heat stress. Okay, noise. So sound, okay, so generated by mechanical vibration that can be detected by human ears. It is force carried out through various mediums, air, water and solids. Okay, and then noise, unwanted sound. Okay, ni kita belajar sikit lah berkenaan dengan signal. So ada components. Okay, so antara components bagi noise tu okay, noise ataupun sound, so dia ada frequency dan ada amplitude. So frequency, number of vibration per second. Okay, dia gunakan unit hertz. Kalau amplitude is a peak magnitude or maximum movement of the sound wave. Okay, biasa gunakan decibel. Okay, so frequency, macam mana kira frequency? Ni kira frequency. Okay, frequency B lebih besar daripada frequency A. Okay, ni tengok frequency. Okay, okay, frekuensi A lebih besar, frekuensi B lebih besar daripada frekuensi A. Maknanya kita run satu cycle dia. Ini banyak cycle dah. Ni baru satu cycle. Okay, kalau ni amplitude pula, ni ketinggian dia. Okay, ni amplitude. Amplitude main dengan ni nilai Y axis. Kalau frekuensi main dengan apa? Main dengan apa? X axis. Okay, so amplitude B lebih besar daripada amplitude A. Sikit lah berkenaan dengan tu lah. So type of noise. Okay, continuous noise. So noise that has the sound intensity between maximum and minimum less than 3 dBA. Okay, amplitude. Okay, so kita ada amplitude, kita ada time, the changing of amplitude less than 3 dB. Okay, ni continuous sound, noise. So ini ada fluctuation noise that has varying intensity level from high to low over 3 dBA. Okay, ni main tinggi lah ni. Okay, ni amplitude dia tinggi. Okay, impulse noise that has high intensity within a short duration, such as the sound of a bullet shot. Okay, maknanya sekali pendek lah maksudnya. Okay, interval noise that occurs at certain duration and may repeat at certain intervals. Okay, so biasa kalau kita bagi kompresor kan, kompresor biasa dia macam ni lah. Maknanya yang macam ni. Sebab kompresor bunyi mesin dia berterutan kan. Continuous noise. So macam ni lah. Okay. Okay, fluctuation noise ni biasa kalau gunakan air pressure lah. Okay, tekanan. Kalau contoh nak sedut, nak lekap apa, kalau yang buat solar panel, dia nak lekapkan, ambil solar panel tu, dia lekapkan guna air pressure. So dia sedut, okay, dia angkat, okay, letak. Setiap benda tu dia ada bunyi dia sendirilah. Alright, so contoh dia lah. So kita ada continuous noise, kita ada fluctuation noise, impulse noise dengan interval noise. So ada 4 So, legal provision related to noise adalah pada factories and machinery. So, daripada FMA. Okay. Factory Machinery Act. Okay, Akta. Akta Kilang dan Mesin Noise Exposure Regulation 1989. Okay. So, legal provision. Okay, permissible exposure limit. Okay. Action level AL ini 85 dBA. Okay, permissible exposure limit. Okay, yang dibenarkan. So continuous noise for 8 hours ni ceiling limit. Okay, ni untuk impulse noise 140 dBA. Okay. Okay, so ni yang antara dibenarkan lah okay, yang dibenarkan. Maknanya tidak melebihi ni lah. Ni kira nilai maksimum. Okay, occupation at risk. So, mining, quarrying. Okay, cari gali kan. Lepas tu construction, manufacturing, textile and etc. Okay. Maknanya setiap pekerjaan ada risiko. Okay, jadi apa yang kita perlu buat adalah berhati-hati dan mengambil langkah berjaga. Right? So health effect. Okay, health effect, disturb emotion and anger. Communication problem, tinnitus. Okay, so tinnitus ni macam dia ada apa bunyi dekat telinga, berdesing gitu. Okay, so and then psychology pressure, increase of blood pressure, damage or loss of hearing. Okay, conduction type, damage to the eardrum, displacement of ossicle bones in the middle ear. Okay, and then ada neurosensory, damage to their hair follicles in the inner ears, loss of hearing, okay, due to overexposure to loud noise, and then normal cases, both ears. So control measures. So engineering controls. So substitution of less noisy equipment. So isolation of noisy equipment from main area. So dari segi engineering control untuk substitute less noise ni, kita ada, tapi kebiasaannya industri dia akan fikir 2-3 kali. Sebab yang less noise ni mahal. Less noise ni mahal. Sebab saya dulu masa di industri, okay, industri yang kedua saya pergi, syarikat yang kedua, dia kita gunakan apa, kita gunakan apa nama dia tu, dia kompresor lah so kita gunakan kompresor. So ada je kompresor yang um, apa, kompresor yang tak berbunyi, maksudnya less noise lah, maknanya tak kuat bunyi dia. Okay, tapi dia mahal. Okay, harga dia boleh bercecah beribu-ribu. Okay, sedangkan yang apa, yang bunyi kuat tu harga dia murah. Itu normal lah. Okay, jadi boleh buat untuk engineering control ni. Jadi biasanya untuk industri yang kecil-kecilan, okay, saya bagi tahu kecil-kecilan, mungkin dia akan ambil yang biasa lah. Tapi macam saya cakap minggu lepas, dari segi kewangan tu perlu ada lah. Misal kata kalau industri tu kecil pun, tapi kewangan dia kukuh, kan, dia apa, jenis dia nak pastikan keselamatan pekerjanya, kan. So dia akan tetap belilah. Okay. So, dari segi administrative control, proper risk assessment before purchase noisy equipment. Ni. Alright, well, lepas cakap. And then ada reduction of exposure to noise. And then training and lectures. Okay, have written policy to ensure safe work practice and then exposure monitoring. Health monitoring. Once annually, okay, kena buat once annually lah. Maknanya secara tahunan untuk health monitoring ni. Yang mana gunakan apa, yang mana kalau ada exposure to PEL. Kan? Apa tadi PEL adalah permissible exposure limit. Right? Okay, lepas tu initial hearing test shows that there is a hearing problem. So kalau ada, so hearing threshold standard. Kita tengoklah. Right? So once every 2 years for noise exposure between 85 hingga 90 dBA decibel. Okay. Right, audiometric booth. Okay, audiometric booth. So untuk vibration, so definition vibration refers to movement of solids where the amplitude and frequency produced may cause harmful to those exposed. Right, and then ada vibrating object kat sini, ada displacement. Okay,